Now, to understand lymph, we need to understand or need to remember that whenever blood is moving through those capillaries, that we have little openings in those capillaries. And if we're moving solutes and stuff like that out of the capillaries into the tissues, well, not all of that fluid is going to get reabsorbed by those capillaries, which means we're going to have fluid in these capillary beds. Now, we're going to call this fluid that's going to be found outside of cells, we're going to call this interstitial fluid. Now, excess interstitial fluid, so interstitial fluid being higher than some level, is going to press with some amount of force on the outside of these lymphatic capillaries. Now, one cool thing with our lymphatic capillaries, and one way that they're a little different than systemic capillaries, is that they are closed-ended, okay? So the outside of the vessel is just completely closed. So it's not an open network. It's not all connected to everything. It's not a series of tubes. In this case, it's basically just this kind of empty tube that we can kind of stick like a finger into the space around the other capillary beds. Now, just like a systemic capillary, we have an endothelium. So it's going to be these endothelial cells. Okay. So once again, only one cell, they're thick, very, very thin. However, unlike systemic capillaries, we actually don't have a basement membrane here that's going to essentially make those endothelial cells be in a different environment than the stuff that's outside. Instead, we don't have that basement membrane. So now that interstitial fluid is touching directly onto the outside of these endothelial cells. Well, also one way that these that the endothelial cells of lymphatic capillaries are different is that they are overlapping. Okay, because these cells are overlapping. So see here, well, you might have one cell here and another one stacked on top of it, another one kind of over here. Well, that means wherever we have these little touch points, those cells can move. So if you actually take and press on one of those cells with excess fluid, now that fluid is going to drain into the lymphatic vessel. And now we're going to call that fluid lymph. Now it's going to have the same stuff in it that is going to be found in all the other interstitial tissues. So this could be any interstitial fluid. So this could be anything from electrolytes, it could be nutrients, maybe a little bit of protein. It could also be cells or cellular debris. Potentially even cancer cells can all kind of force their way through these overlapping endothelial cells and work their way into the lymphatic capillaries. Now, as you can see here, we have this systemic capillary bed where we've got basically a normal capillary bed, and then we've got all these little finger-like appendages of lymph vessels sticking their fingers in here so that we can absorb any of that fluid that does not get reabsorbed by the blood. This way that we can return that fluid back to the blood so that we can maintain blood volume. That's kind of one of our whole goals here, is making sure that we can absorb this excess fluid and get it back to the blood. By getting it back to the blood, we can maintain overall blood volume, which also helps us maintain things like blood pressure. Now, once we have the lymph inside the lymphatic capillaries, we're going to continue pressing that lymph and moving it along by having additional lymph come in behind it, okay? Now, the reason that we can't escape from these overlapping cells is because the cells basically overlap in such a way that they allow stuff in, but they don't allow things out. This is basically like how a lot of like crawfish traps and stuff like that work. It's fairly easy for them to squeeze through on the way in, but then it is very much more, or it's much more difficult for them to squeeze their way out. And that's because the cells are overlapping and now they're pushing against supported regions. So you might have multiple layers of cells, or at least a couple layers of cells interacting. So that's going to keep the water from being able to get back out. Now, to help hold everything in place, we actually have these structures called anchoring filaments that are going to help anchor these lymphatic capillaries in place so they can't really go anywhere. Now, as that fluid moves, it's going to go from the lymphatic capillaries and it's going to enter larger vessels called lymphatic vessels. Those are then going to drain into lymphatic trunks, and then those are going to drain into lymphatic ducts. There are really only two lymphatic ducts, and we're going to talk about those shortly. Now, one other thing to keep in mind here, that to understand the flow of the lymph, we need to realize that we are dealing with a very low pressure system here. We don't have the heart that's pushing this fluid and making sure that things are moving all orderly. Instead, we're relying basically just on hydrostatic pressure itself and some muscular pump and stuff like that. So muscular pumps, respiratory pumps, as well as the movement of blood in nearby arteries. All of this is going to help move the fluid through here, but we actually don't have something massive like the heart that's forcing the blood through the system here. So because of that, pooling is a potential issue. We want to make sure that the fluid doesn't always just drain back down. So to help with that, once again, we have valves. So this should sound pretty familiar. Now the lymphatic vessels, so once we get away from the lymphatic capillaries, also have the same 3 vessel tunics. So intima, media, and outside. All right. Now, the lymphatic trunks are essentially just going to be places where we're going to take the lymphatic vessels and then get them to drain into these. So we go from lymphatic capillaries to lymphatic vessels to lymphatic trunks. A few of the major ones are jugular trunks. So this is going to be one in kind of the head and neck, particularly near the jugular vein. Subclavian trunks, which are going to be ones from the upper limbs. Bronchomediastinal. So broncho meaning like your bronchus, so likely dealing with our lungs, and then mediastinal, once again, that's that kind of region at the top of our chest. So we're dealing with thoracic structures at this point. The intestinal trunks, makes sense that those are abdominal. And then finally, the lumbar trunks, which is going to be stuff from the lower limbs, basically all coming together there. These are going to drain into the lymphatic ducts. The lymphatic ducts are the largest lymphatic vessels. So basically, these are the ones that are actually going to be returning the fluid to the blood, okay? Namely, these are important because there are 2. We have the right lymphatic duct, which is right near that right clavicle. This is going to drain blood from the right upper quadrant of the body. So it's going to be things from the right side of the head and neck, the right upper limb, and the right side of the chest. Okay, so the right side of the thorax. That's it. So basically from that line out, if it's not in that region, it's all going to drain through the thoracic duct. Okay, so the thoracic duct is going to drain from everything else. Now, one part of the thoracic duct that's interesting is it's going to be this little structure called the cisterna chyli. It's going to be found kind of right down here. This one is actually going to be receiving some very lipid-rich lymph from the GI tract. This lipid-rich lymph we're going to call chyle. That's because it's basically going to be this somewhat milky looking solution because of all the fat that's in it. Remember that fat doesn't flow well or move well in water. So this basically gives us a second route to move those fatty substances other than just through the blood.